A slightly unusual cause of lateral hip pain, which is really more side of the thigh pain, is Meralgia Paraesthetica. This is an unusual one where a small nerve that supplies the outside of the thigh, which is a lateral femoral cutaneous nerve, becomes trapped and irritated. It happens in a very particular place as it passes from the deep nerve, where it's out across the anterior or the front side of your pelvis underneath your inguinal ligament, just towards the medial side or the inside of the bony prominence, the anterior superior iliac spine of the pelvis. This is diagnosed clinically. You see your local doctor, you describe the pain, and they'll recognize this kind of pain. This can be quite a nice little way to treat this thing. So what I do is I clean the skin. We use the ultrasound to find where the nerve runs. You can attempt to find the nerve, but it's often fairly poorly seen. It's a small nerve and you need to know where to look for it. An easier approach is to actually just find exactly the tunnel which it runs through, that small little gap between those structures I described before, and then to do an injection in that space, because you know that's where it runs and that's how you can pick it up. What you do is you inject, you flood the area essentially entirely with a long-acting local anesthetic and with a corticosteroid or an anti-inflammatory medication, and thereby you treat that pain. If that is the cause of your pain, which it more or less often is, if your pain is specific to that area, this can be quite a useful technique. It decreases the inflammation from it running through that small space and rubbing against things, and the local anesthetic gives quite good long-acting relief over the course of a few hours. In that sense, it's also a diagnostic procedure, because if you get great relief even from the local anesthetic for a few hours, it gives us a good insight that that's the cause of your pain. The corticosteroid then has to do its job and decrease the inflammation in there over the course of the next week or two. Sometimes if it's significantly inflamed, it will come back and you may need to have the same or other procedures to try and treat that pain. That's Meralgia Paraesthetica.